Hello everyone and welcome to our presentation on blood glucose and A1C testing. I will begin by explaining what the blood glucose is and why our body needs and how it's regulated. So glucose is the main source of energy for our cells. Every organ in our body, especially the brains, depends on a steady supply of glucose to function properly. Mm, how glucose en- en- enter to our body? We get glucose from the food we eat. After digestion, glucose enters the bloodstream and from there is needed to move into the cells to the use it and is used as an energy. Mm, we have insulin and glucagon. That is the process is controlled mainly by two hormones produced into the pancreas. There is insulin and glucagon. The insulin is which level blood glucose by helping cells absorb it, and the glucagon is which raises blood glucose when levels drop too low. So together they keeps glucose within a healthy range. So how does the insulin work? Okay, so this image illustrates how the body regulates the blood glucose levels and after we eat. On the left side, we can see that when glucose level rise, usually after a meal, the pancreas responds by releasing insulin. The insulin molecules shown at the top of the image travel through the bloodstream and signal the body cell to take it into the glucose. This allows glucose to move from the blood into the cells where it can be used as energy. And as a result, blood glucose levels begin to drop back to the normal range. In the center of the image, we see the liver, which also play an important role. When the glucose is high, the insulin tells the liver to store extra glucose as a glycogen. Then the green circle shows both glucose and glucagon, while the insulin's lower blood glucose. Glucagon has the opposite effect. When blood sugar becomes too low, glucagon signals the liver to release stored glucose back into the bloodstream. Overall, this diagram shows the balance between insulin and glucagon and how together they maintain normal blood glucose level. Okay, what happens when if regulation fails? When the system doesn't work correctly, blood glucose becomes abnormal. So too much glucose causes hyperglycemia, which is common in diabetes, and too little glucose causes hypoglycemia, which can be so dangerous for us. So, what is the A1C test? Finally, before passing to the next speaker, it's important to understand that the A1C test measures how much glucose attached to hemoglobin inside the red blood cells. Because the red cells live about 3 months, the A1C reflects the average blood glucose after that time. This give, gives us a long-term information that a single glucose test cannot.
What happens if regulation falls? When this system doesn't work correctly, blood glucose becomes abnormal. Too much glucose causes hyperglycemia, which is common in diabetes, and too little glucose causes hypoglycemia, which can be dangerous. What is the A1C test? It's important to understand that the A1C test measures how much glucose attaches to hemoglobin inside the red blood cells. Because red blood cells live about 3 months, the A1C reflects the average blood glucose over that time. This gives us long-term information that single glucose tests cannot. What is the relationship between HbA1c and the average glucose levels? The HbA1c percentage reflects the average glucose levels in a patient's body over the last 90 days. We need to test. The Center for Disease Control, the CDC, recommends A1C testing for diabetes and prediabetes if you're over the age of 45, and if your results show prediabetes, it needs to be tested every 1 to 2 years. If your results show you have diabetes, test it at least twice a year to monitor your condition and treatment. You are under the age of 45 and are more likely to develop diabetes because you have prediabetes, are overweight or have obesity, have a parent or sibling with type 2 diabetes, have high blood pressure or high cholesterol levels, have heart disease or have had a stroke, are physically active less than 3 times a week, have had gestational diabetes, that's diabetes during pregnancy, or have given birth to a baby over 9 pounds, or if you're African American, Hispanic, Latino, American Indian, or Alaska Native person. Some Pacific Islanders and Asian American people also have a higher risk for developing diabetes, or if you have polycystic ovarian syndrome.
For hemoglobin A1C test, we can use analyzer to measure hemoglobin A1C from capillary figure stick. Moreover, we can use a venous sample to test as a whole blood. For hemoglobin A1C test, patients do not have to fast for this test because it reflects long-term blood sugar control rather than immediate glucose level. In case of use capillary POC testing, the test should be confirmed with venous sample before diagnosis. Moreover, the test should be sent to laboratory that's certified by NGSC to ensure the standard of the result. For hemoglobin A1C testing, there are several tests that are available for hemoglobin A1C. For example, high-performance liquid chromatography or HPLC, or immunoassay-based method can be tested by latex agglutination inhibition or enzyme immunoassay using analogous antibody. Moreover, we can test hemoglobin A1C by enzymatic assay by using fructosyl peptide oxidase and POC device. This is normally for POC device that you approximately 0.5% lower than laboratory-based assay and may exhibit reduced accuracy compared with venous blood samples. However, there are several factors that influence the hemoglobin A1C level. For example, erythropoiesis. Some factors that can increase hemoglobin A1C such as iron or vitamin B12, and some factors decrease hemoglobin A1C level, for example, administration of erythropoietin. Second, alter in hemoglobin, for example, in case of genetic or chemical alteration in hemoglobin. For example, hemoglobinopathy. Direct glycation. The factor that can increase hemoglobin A1C such as alcoholism, and some factors decrease hemoglobin A1C such as aspirin or vitamin C and E, and some factors that can variable hemoglobin A1C such as genetic determinant. The other factors such as erythrocyte destruction. Factors that can increase hemoglobin A1C such as increased erythrocyte lifespan, for example in case of splenectomy. And the factor that can decrease hemoglobin A1C such as decrease in erythrocyte lifespan, for example hemoglobinopathy, splenomegaly. And some may be affected by assay itself, for example increased that hemoglobin A1C such as hyperbilirubinemia. And the factor that can variable hemoglobin A1C such as hemoglobinopathy and some decreased hemoglobin A1C such as hypertriglyceridemia. In conclusion, hemoglobin A1C is a well-established marker that can reflect average blood glucose over 3 months and serve as a reliable indicator for long-term glycemic control. Moreover, hemoglobin A1C tests, when used with diagnosed diabetes, should be performed using clinical laboratory equipment. But when you use the POCT testing, it's also convenient, particularly in resource-poor setting and when patients require frequent testing. However, you have to avoid when using POC for hemoglobin A1C testing for diagnosis of diabetes. The clinician must be aware of cause of false positive and false negative results. And the last one is interference from hemoglobin variant is still concerned, but nowadays the most laboratory are using methods that show no interference from the most common variant. This is the reference that we use. Thank you for your attention.